Hands Only CPR. Anyone can save a life. So what is Hands Only CPR? Hands Only CPR is the most basic of CPR skills that anyone can learn. It's also known as Compression Only CPR or CPR without breaths. Does it work? Yes. If started within the first few minutes, Hands Only CPR is almost as effective as traditional CPR. Who can perform Hands Only CPR? Anyone. Hands Only CPR is designed for anyone to take action. Yes, even you. Can I really perform Hands Only CPR without a certification? Yes. Pennsylvania's Good Samaritan law protects you. The law is in place to protect individuals from civil liability when care is rendered in good faith in an emergent situation. This law applies to the use of CPR techniques and other emergent responses prior to the arrival of medical personnel or admission to the hospital. A person is protected under the law provided that their actions are not intended to harm or are grossly negligent. When should I use Hands Only CPR? Hands Only CPR should only be used on adults and teens, and only if you witness the issue starting, such as if someone has a sudden cardiac arrest or collapses. So when should I not use Hands Only CPR? Traditional CPR is much better and should be used for infants, children who have not reached puberty, victims of drowning, drug overdoses, prolonged cardiac arrest, choking, or those who collapse due to breathing problems. In any of these cases, call for help and use traditional CPR if you've been trained. How to perform Hands Only CPR? First, call for emergency response. In most cases, just dial 911. Then start chest compressions. To start chest compressions, find the center of the victim's chest. Place one hand over the other with fingers interlocked. Begin to push fast and hard. So, how fast? The push rate should be at least 100 compressions per minute. Think about the beat. And how far? The compression depth should be at least 2 inches. Let's watch Hands Only CPR in action.
I don't feel so good.
Why? What's wrong?
I just don't know.
Are you okay? I need some help. We were walking, he was fine, and then he just collapsed.
Hey, are you okay? Call emergency response now.
Hands Only CPR can be performed by anyone who witnesses an adult or teen collapse. The first step is to call for emergency response. Next, find the center of the victim's chest and place one hand over the other with fingers interlocked. Begin chest compressions. For each chest compression, push at least 2 inches straight down, and then release the pressure without having your hands come off the chest. Repeat this cycle at a rate of at least 100 compressions per minute. Continue this until you are relieved by someone who is trained in CPR or is an emergency responder. Want to learn more? Take a CPR class. Lancaster General Health offers many different classes to learn CPR and other life-saving skills. You can review class descriptions and register online. And remember, with Hands Only CPR, anyone can save a life.